Hello, my name is Amelia Francis and it's Sunday the 12th of May 2013. I'm sitting here with Mr. Jones in his living room and I'm about to undertake a full medical assessment, doing his radial pulse, blood pressure, respiratory rate, as well as undertaking a full examination of his chest, doing chest auscultations and obtaining a GCS score. I'm abiding by normal safety precautions with gloves and goggles. Okay, so now I'm going to take Mr. Jones's radial pulse by palpating his wrist and counting how many pulse beats I feel over 30 seconds and doubling the result. Then directly after that, or straight after that, I'm going to also take his respiratory rate, but I won't inform Mr. Jones that I'm doing that because I wouldn't want him to subconsciously or consciously alter his breathing rate because he knows I'm counting them. Okay, so Mr. Jones, how are you doing today?
Oh, well, thank you.
Well, thank you. Have you ever had your pulse taken before?
Well, yes, I have.
You have? Do you remember what it was?
No idea.
No? Okay, well, do you remember if it was normal or abnormal?
Normal, yes.
It was pretty normal? Okay, that's good. So we'll take it now and I'll let you know what it is. Do you mind if I just take your wrist here? Okay, so we're just going to keep it nice and relaxed while I take this. Just sit nice and still. Breathe normally. Okay, so Mr. Jones, your heart rate, your pulse was 56 beats per minute and your respiratory rate was 16 breaths per minute. So they're both completely within the normal range, which is excellent. You're calm, you're fit, you're relaxed.
Thank you.
Fantastic. Okay, so Mr. Jones had a pulse rate of 56 beats per minute, which is normal, just use the normal palpation method. And then his respiratory rate was 16 breaths per minute, which is also completely within the normal range, indicating that he's relaxed, calm, all is going well. Okay, so now we're going to move on to take Mr. Jones's blood pressure by both the palpation method first to find his systolic blood pressure, and then move on to the auscultation method to get both his systolic and diastolic or overall blood pressure. Okay, Mr. Jones, have you ever had your blood pressure taken before?
Yes, I have.
You have? Do you remember what it was?
I think it was 120/80.
120/80, that sounds completely perfect. So, you know the whole deal with this. You've seen a stethoscope before?
I have.
And you've seen a BP cuff before?
I have.
You had a pink one before?
No, I haven't seen a pink one
It's a
before.
bit cool. Gotta have a big one. Alright, so what we're going to do is, we're going to put this around your arm. It's going to feel nice and tight, but hopefully not uncomfortable. Just roll that sleeve up just a smidgen. Oops, you're dropping it. Pop that up there. Just rest your arm here and just leave it relaxed and nice and calm. Okay, so Mr. Jones's systolic blood pressure is 110, which is right within the normal range. So now we're going to do both your systolic and your diastolic blood pressure, pretty much the same deal as before. We're just going to have a stethoscope on your arm so I can hear what it is. So you've had this done before?
I have.
Excellent, I'll know the deal then. It'll get a bit tight like before, but not too bad. Stop. Let's just take this off. Okay, so Mr. Jones's blood pressure is 110 on 75, which is right within the normal range, which is good. Okay, so now we're going to have a listen to Mr. Jones's lungs to make sure they sound all clear and there's no odd or unusual sounds in there. We're going to listen to 8 points on Mr. Jones's back and listen for 2 breathing cycles on each point. Okay, Mr. Jones, have you had someone listen to your lungs before, I assume?
Yes, I have.
You have? How did they sound?
Normally they're clear.
Normally they're clear? That's excellent. So I'm just going to do 8 points on your back. So can I just get you to lean forward? You already are. Just have a quick cough to clear any phlegms out of there. Okay, get you to breathe deeply in and out through your mouth. Excellent. And do you mind if I stick this under the top of your t-shirt?
No trouble.
That's fine? Okay. Big deep breaths in and out through your mouth. Okay, so your lungs sound fantastic. No unusual sounds, no nothing. Okay, so Mr. Jones's lungs sound all clear. Everything's great. Okay, so we're nearing the end of our little assessment of Mr. Jones here. All we've got left to do now is calculate his GCS score. Because his eyes have been open and following me the whole time, therefore he receives 4 out of 4 for that section of the assessment. There's no reason to really test it. So we'll just test his verbal responses and motor responses. Okay, Mr. Jones, we're nearly done here today. Before we finish, just have a few probably silly questions to ask you, okay? So can you tell me what day of the week it is today?
Sunday.
It's Sunday, good. And what month?
May.
May. And what season are we in at the moment?
Autumn.
Autumn. And can you tell me what year it is?
2013.
2013. And where are you right now?
In my living room.
In your living room in your house. Excellent. Okay, so Mr. Jones got all those questions fine, so he receives 5 for that section of the assessment. Okay, just something really quick. Can you just grab my fingers with each hand and squeeze them? Okay, so Mr. Jones' grasping is fine, therefore motor skills are all okay. There's no reason to inflict pain to test that response because we know he's all good. So 6 out of 6 for that section. So that means you get a GCS score, Mr. Jones, of 15, which is perfect. High as you can get. Alright, so we're all done with Mr. Jones today.